Hello, thank you for joining us and Happy New Year. I'm Sandy Potter, along with Masonicare President and CEO, JP Venoit, Dr. Ronald Schwartz, our Senior Director for Continuum Health Services, and we're very happy to have Sierra Drevline with us again. She, of course, is the Director of Employee Health Services for Masonicare. Welcome back to you all.
Thanks for having us.
Dr. Schwartz, it's hard to believe, but we are close to the 2-year mark in this pandemic now. And the questions of when and how it might end or shift to being an endemic remain as cases surge. Can you fill us in on what some experts are saying about that?
Certainly do my best, Sandy, and let me say Happy New Year. It's a lot of stress we're under with this pandemic continuing, but I do have an article that we found that's a bit upbeat, and it does talk about the title of it says, despite Omicron, COVID-19 will become endemic. Here's how. So we're going to talk a little bit about, again, I did condense this, it's quite a lengthy article, but we'll talk about some of the differences between a pandemic and an endemic and how we're moving along. So I'm going to read this, and there's some quotes as well from different experts. So as they say, the variant has changed how we get from pandemic to endemic, but that doesn't mean we're back to square one, which is really important. So with Omicron rates soaring, you may find yourself asking when or even if the pandemic is ever going to end. But this is good news, because they say the good news is that it will end. Experts agree on that. We're not going to totally eradicate COVID-19, but we will see it move out of the pandemic phase and into the endemic phase. Endemicity means the virus will keep circulating in parts of the global population for years, but its prevalence and impact will come down to relatively manageable levels. So this way it ends up more like the flu than a world-stopping disease. So for an infectious disease to be classified in the endemic phase, the rate of infections has to be more or less stabilize across years rather than showing big, unexpected spikes as COVID-19 has been doing. So this is actually a quote from a Boston University epidemiologist, and her name is Eleanor Murray. And as she said, a disease is endemic if the reproductive number is stably at 1. So what does that mean? So it means one infected person on the average infects one other person. So that's important to really understand when we're talking what an endemic is. Unfortunately, right now, we're not near that. And the highly contagious Omicron variant means each infected person is infecting more than one other person, with the result that cases are exploding across the globe. So they say, here's one big question that you'd probably like the answer to. Does Omicron push endemicity farther off into the future, or could it actually speed up our path to endemicity by infecting so much of the population so swiftly that we move more quickly to develop a layer of natural immunity? So this is a quote from Angela Rasmussen. She's a virologist in Canada, and she says, that's really the $1 million question. It's really hard to say right now. That's partly because endemicity isn't just about getting the virus's reproductive number down to 1. That's the bare minimum for earning the endemic classification, but there are other factors that come into play as well, like what's the rate of hospitalizations and death, and is the healthcare system overburdened to the point that there's a precipitous space or staffing shortage? Are there treatments available to reduce how many people are getting seriously ill? And even though Omicron so far seems to result in more milder diseases than previous variants, a massive increase in cases could still lead to a big increase in hospitalizations and deaths. And this could further stress the healthcare systems that are already in dire straits. That's why Rasmussen concludes that Omicron certainly has the potential to delay endemicity. So we're almost done. We're in the final conclusions of this article. And again, there's a lot to say here, but this is a quote from Joshua Mashad. He's actually the Associate Director for Global Health Policy at the Kaiser Family Foundation. And he said there's some hopeful things to bear in mind. The incredible number of infections is building up population-level immunity. That will be crucial in terms of muting future waves. And this is why Rasmussen says the key determinant of when the pandemic ends is how long it will take to make vaccines accessible around the world and to combat ongoing vaccine hesitancy. So currently, we're not vaccinating the globe fast enough to start the virus of opportunities to mutate into something new and serious. If only a small, this is a quote again from Rasmussen, who said, if only a very small proportion of people are getting access to vaccines, we're just going to keep playing variant whack-a-mole indefinitely. So this is the final point I see. In the meantime, we do have another ace up our sleeves, which hopefully will also become available around the globe sooner rather than later. So there are new treatments you may have heard of, like Pfizer's Paxlovid, recently approved by the Food and Drug Administration, and Merck's Molnupiravir, not an easy word to say, but anyway, also FDA approved, that reduced the rates of hospitalization and death from COVID-19. So the final quote, again from Joshua Mashad, is very important in the context of endemicity is the antiviral pills. If we have these tools, we're looking at a very different state going into 2022. People shouldn't feel like we're back to square one. So even though there are a lot of negative things that we're hearing, we're ending on hopefully a more positive note going forward. So I'm going to give you my inspirational quote for the week, which says, never regret a day in your life. Good days give happiness, bad days give experience, worst days give lessons, and best days give memories. I like that quote. This was actually by Dr. Sukraj Dhillon. He's actually a professor at Yale University, and he's an author of many books on the subjects of science, religion, and spirituality. So I guess to end my part of the presentation, I want to wish everybody a really happy new year. I know it seems discouraging, but there is a lot of hope out there, and we just have to continue to stay the course, with getting vaccinated, the good health practices, wearing masks, and we'll get through this together. So again, thank everybody for all their hard work and their diligence. And as I always say, health and peace. Thank you.
Well, thank you, Dr. Schwartz, as always, for breaking that down for us, leaving us with a lot of hope and reminding us that every day is something to cherish. Sierra, here at Masonicare, we continue a robust vaccine clinic schedule. Can you tell us how that process is going at this point?
Yes, Sandy, thank you. We have approximately 45% of our staff body on, that's not including our contracted staff, that have been vaccinated with booster. We've had some delays in vaccination due to quarantine and isolation, but we continue to make the vaccine as available as possible by scheduling booster clinics throughout January at various locations. So we have them weekly, sometimes more often, in order to adhere to that January 31st deadline that we had advertised weeks ago. We also continue to work with our pharmacy partners to schedule some Saturday clinics. We look forward to having a family clinic available on the weekend towards the end of the month as we avoid inclement weather and the majority of this surge during the pandemic. And lastly, I just want to say thank you for all the hard work our staff is doing. These are challenging times, but there is a light at the end of the tunnel, and that's herd immunity. So we'll get through it together because we are better together. Thank you.
Thank you so much, Sierra, for all your efforts, and that was just perfectly said. And finally, JP, in light of this latest surge, we have put some extra safety measures in place in our residential communities. Can you bring us up to date?
Yes, Sandy, thank you. Happy New Year to everyone. And I echo both Dr. Schwartz and Sierra for the well wishes of our staff and a very safe 2022. When we talk about some of the things that we're doing on our residential living side, we have really clamped down a little bit, if you will, on large activities outside, events, dining rooms. We've unfortunately kind of restricted how much our residents are going into our dining room and doing more of a delivery service. And my expectation is this is going to be a short time. As we've kind of endured the COVID pandemic, which interestingly enough, 673 days ago, we started our task force, and 647 days ago was our first case that Masonicare had to care for a COVID individual or COVID resident. So we have been battling this, but I am, as Dr. Schwartz also said, very optimistic that we are coming out of this COVID pandemic with some very positive news. Though the last few days have been a little challenging with the number of cases here in Connecticut, we have seen some new drugs coming out. Both the Pfizer and the Merck drugs, I think, bring hope, bring some normalcy to combating this terrible virus. So we are very optimistic that over the coming year, I think we're going to see us coming out of this pandemic to more normalcy. As part of that, though, in many of our communities, we are looking at ways in how we can mitigate some of the spread. And I am happy to say, as of today, we have very few cases of residents who have COVID. And those that may have it are showing very little symptoms, if any symptoms. So this time around, this wave is substantially less destructive, if you will, to our population. Sierra said it very eloquently before. Our staff have done a truly amazing job. And I can't tell you how proud I am and how humbled I am that I have the opportunity to work with all of them. They have done an extremely tough job with compassion and care through the whole time. And I can't tell you again how proud I am of all of our staff. And to our residents, thank you for your understanding and for your commitment. It has been a very challenging time for our residents who live in our communities, and to have the dining room open and close and activities open and close or be smaller sizes. It has been a very challenging time for them and frustrating. But I cannot tell you how many phone calls I've received in the past week or two saying thank you for all that your staff have done to keep us safe. And I think that's the most important thing for everything that Masonicare has strived to do during this COVID pandemic. And that has been to do everything we can to keep everyone safe, whether it be our residents, whether it be our staff, whether it be visitors coming to our campuses. We are doing everything we can to keep everyone safe. So Happy New Year. There is light at the end of the tunnel for 2022. And I will tell you that I am extremely optimistic that over the coming months, we will be getting ourselves to more of a positive normalcy for everyone.
Thank you so much, JP. We are in this together. We will get through it together. We will remain Masonicare strong. Thank you all for sharing your time and your insights as always. And of course, we thank you for joining us at home. Until we see you next time, we hope you'll stay safe and stay well.